Hello, and thank you so much for joining me today to learn how to choose a Part D prescription plan. My name is Melissa Devine. I am the Site Coordinator for the Medicare Medicaid Assistance Program with the Area Agency on Aging 1B. Let's get started. Today, we're going to discuss who MAP is, what we do, a brief understanding of Medicare, and specifics on Medicare Part D, what it is, what it covers, the coverage restrictions, how to enroll, when to enroll, and more. The Medicare Medicaid Assistance Program, referred to as MAP. MAP is comprised of unbiased counselors located all across Michigan, offering free health benefit counseling assistance. Our counselors have gone through extensive training to become certified, are not affiliated with insurance companies, and are able to assist with comparisons in Medicare. A MAP counselor can help you understand Medicare health plans, compare and enroll you in Medicare Advantage coverage, compare and enroll you in Medicare prescription drug coverage, help you identify and report Medicare and Medicaid fraud and scams, and assist you with enrollment into low-income programs like the Low-Income Subsidy Extra Help Program and Medicaid. Now let's take a brief look at understanding Medicare. Medicare is health insurance for three groups of people: those that are 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease. It is administered through the Centers for Medicare and Medicaid Services, and enrollment takes place for most through Social Security Administration. For railroad retirees, enrollment will take place through the Railroad Retirement Board. Medicare has well-defined benefits and exclusions. It does not cover dental, hearing, or vision care except under special circumstances. It does not cover long-term custodial care. It does place limits on certain care items such as physical therapy, durable medical equipment, and more. And it does not cover over-the-counter medications. Medicare does work with private insurance companies to provide you Part D prescription drug coverage, a supplemental or Medigap policy to help fill in the gaps in original Medicare, and with Medicare Advantage plans, which combine parts of original Medicare with prescription drug coverage and often some dental, vision, and hearing coverage. There are four parts to Medicare: Part A, hospital insurance; Part B, medical insurance; Part D, prescription drug coverage; and Part C, Medicare Advantage plans. These are HMOs and PPOs, and they are a combination of original Medicare Parts A, B, and D, all into one plan. When you first become eligible for Medicare and during certain times of the year, you have options in how you'd like to receive your Medicare coverage. The first option is with original Medicare. This includes Part A and Part B. You can add a Part D prescription drug plan, and you can also add a Medigap or a Medicare supplemental insurance policy to help cover the gaps in original Medicare. The other option is with Medicare Advantage, Part C, and this is an HMO or a PPO that includes Part A, Part B, and Part D into one card, along with some extra benefits. Original Medicare. Original Medicare has Part A, the hospital insurance, which covers your stay at a hospital under admission, skilled nursing facility care, home health care, and hospice care. You also have Part B, which is the medical insurance, which covers doctor visits, outpatient hospital services, clinical lab tests, preventative services, durable medical equipment, and more. When enrolling in Medicare, it is automatic for those who are receiving Social Security retirement benefits and Railroad Retirement Board benefits. An initial enrollment period package gets mailed 3 months before the 25th month of a disability benefit or 3 months before you turn 65. If you do not receive automatic enrollment through Social Security or the Railroad Retirement Board, and you are maybe perhaps still actively working, you can enroll in Medicare with Social Security. You can visit their local office, call their 800 number, or online at ssa.gov, fill out an application. If retired from the Railroad Retirement Board with Railroad Retirement, you'll want to call the local Railroad Retirement Board office at their 800 number to enroll in Medicare that way. You don't have to be retired to enroll in Medicare. Your initial enrollment period lasts 7 months. It begins 3 months before your 65th birthday. It includes the month that you turn 65, and it ends 3 months after you turn 65. There's also other times when you may be able to enroll in Medicare, but you could be subject to pay a penalty if you delay your enrollment. Now let's look at Medicare Part D. Medicare's prescription drug benefit, also known as Part D, provides prescription drug coverage to Medicare beneficiaries. This benefit is only available through private insurance companies that contract with Medicare. Part D is offered either as a standalone plan for those enrolled in original Medicare or as a set of benefits included with your Medicare Advantage plan. When choosing a Part D plan, it is important to understand what it is that's covered, how much it costs, and how you can find the right plan and enroll in it. Medicare Part D covers outpatient prescription drugs. Each Part D plan has its own formulary, which is a list of drugs that the plan covers. The law requires that all Part D plan formularies are meant to include at least 2 drugs in most categories or classes of drugs, and substantially all drugs in the following 6 classes: immunosuppressants, which are used to prevent an individual's body from rejecting an organ after transplant; antidepressants, which are used to treat depression; antipsychotics, which are used to treat schizophrenia and bipolar disorder; anticonvulsants, which are used to treat epileptic seizures; antiretrovirals, which are used to treat HIV and AIDS; and antineoplastics, which are used to prevent the development of tumors. Some drugs are excluded from Medicare coverage by law and cannot be covered by any Part D plan. These include drugs that are used to treat anorexia, weight loss, or weight gain. However, Part D may cover drugs used to treat physical wasting caused by AIDS, cancer, or other diseases. Other medications that could be excluded are fertility drugs, drugs used for cosmetic purposes or hair growth, drugs that are only used to treat cough or cold symptoms, drugs used to treat erectile dysfunction, drugs that have not been approved by the FDA, drugs prescribed for uses other than those approved by the FDA, and prescription vitamins and minerals except for prenatal vitamins and fluoride preparations, which can include most over-the-counter drugs. Part D must include all commercially available vaccinations on their formularies as well, such as the shingles vaccine. The Part D plan pays for the vaccination itself and for your doctor or other healthcare provider to give you the shot. Immunizations for influenza, pneumonia, hepatitis B, and some other immunizations that you may need if you're exposed to dangerous disease or virus, such as tetanus, are covered by Medicare Part B. The COVID-19 vaccine is also covered under Medicare Part B, and you will owe no cost sharing, including deductible, coinsurance, or copayment. There are a number of costs associated with your Part D plan. You may have a monthly premium, an annual deductible, coinsurance amounts, or copayments for your covered drugs. A premium is an amount that you pay monthly to have coverage. An annual deductible is an amount that you may pay out of pocket before your plan begins to cover your prescription drugs. And a coinsurance or copayment is the amount that you pay out of pocket for your covered medications. A coinsurance amount is a percentage of the cost of the drug, So if your plan charges, let's say, a 15% coinsurance for covered generic drugs, that means that you're going to pay 15% of the cost of that drug. A copay is a set amount, which is a $20 copay for a covered generic drug. Many Part D plans, though, use tiers to price their drugs that are listed on their formularies. Typically, drugs in lower tiers are less expensive, and drugs in higher tiers are more expensive. An example of a tier structure is Tier 1 being a generic drug, Tier 2 is a preferred brand name drug, Tier 3 being a more expensive brand name drug, and Tier 4 being a specialty drug. Please note that these are not official drug tiers. Some generic drugs may be listed higher in tiers. When selecting a Part D plan, it's important to consider how much you'll be paying each month for your meds. This includes noting if your drugs are in lower or higher tiers on the plan's formulary and what their copayment or coinsurance charge will be. Coverage restrictions, also known as utilization management tools, come with rules that you have to follow before your plan will cover your drugs. There are three main types of coverage restrictions: prior authorization, step therapy, and quantity limits. Prior authorization means that you must get approval from your Part D plan before the plan will pay for the drug. Your provider is often part of this process and can provide the documentation needed to prove that the medication is medically necessary. Step therapy means that your plan requires you to try a different, less expensive version of your drug before it will cover the more expensive one. Quantity limits restrict the quantity of a drug, and you can get your prescription filled, which would include perhaps a limit of 30 pills of that medication per month. Throughout the year, you may notice that you're paying different amounts for your drugs. This is because Part D plans have coverage phases, during which you would pay different amounts for your covered prescription drugs. These coverage phases are the deductible phase, the initial coverage phase, the coverage gap, and the catastrophic coverage phase. If your plan has a deductible, you start off the year in the deductible phase. During this time, you pay out of pocket for the entire cost of your drugs. After you've met your deductible, if you have one, you move on to the initial coverage period. During this time, you and your plan share the cost of your prescription drugs, and you will pay the plan's copays or coinsurance amounts at the pharmacy. After your total drug costs reach a certain amount, you enter the coverage gap, formerly known as the donut hole. This amount combines your copays or coinsurance amounts with the amount that your plan has paid for drugs. This is important to note that the low pharmacy copays do not necessarily mean that you will not reach the coverage gap. When you enter the coverage gap, you will be responsible for 25% of the cost of your medications. The last coverage phase is the catastrophic coverage. Once you've met the true out-of-pocket for the year, you will move out of the coverage gap and into the catastrophic coverage. This amount includes your deductible, copays or coinsurance amounts that you paid during the initial coverage period, the almost full cost of brand name drugs, including the manufacturer's discounts that were purchased during the coverage gap, and any amount paid by your plan does not count to get you into the catastrophic coverage. Your monthly premium and the cost of non-covered drugs also do not count. During the catastrophic coverage, you'll pay 5% of the cost for each of your drugs. Your plan should keep track of how much money you've spent out of pocket on your covered prescription drugs and which coverage period you are in. This information will be printed on your monthly statements, known as the explanation of benefits. There are many things to consider before choosing a Part D plan. Depending on your needs, your financial situation, and your preferences, some of the following questions and guidelines may be more important to you than others. Does this plan cover my drugs? If you take a lot of prescriptions, then choosing a plan that has your drugs on its formulary is an important first step. If the plan does not cover your drugs on its formulary, then you may end up paying out of pocket for the entire cost of the drug. You should create a list of the names of the prescriptions that you take, their dosages, and whether they are brand name or generic. This can help you sort through plans and choose the ones that cover your drugs. You should also find out if there are any restrictions on your covered drugs, such as prior authorization, step therapy, or quantity limits. A MAP counselor can help you do so by contacting the plan or looking at the plan details in Medicare's Plan Finder tool. It is important to note that these, as they may affect your access to drugs at the pharmacy and may require you to speak to your doctor. What are the costs that are associated with this plan? You may want to know, if you choose a plan with a deductible, how much you're going to have to pay out of pocket before your plan begins to cover your prescription drugs. Some people prefer to have a deductible if it means that their monthly premium is lower, while others may prefer to pay a higher monthly premium instead of paying out of pocket to meet a deductible. You should also think about the most that you can spend or want to spend on the drug plan's monthly premium. You'll also want to know if your pharmacies are preferred or in network. Many drug plans include both preferred and non-preferred pharmacies in their networks. You may pay less for your drugs at a preferred pharmacy than at a non-preferred pharmacy. If you go to a pharmacy that's close to your home or easy to get to, it may be beneficial to look for a plan that categorizes that pharmacy as a preferred in-network pharmacy. Some plans may even have a mail order option that may have cheaper prices than your local pharmacy does. If you prefer mail order, you can look for a plan that includes that option. If you prefer to pick your drugs up at the pharmacy, be aware if your plan has a mail order option and if it will affect your coverage in any way. For example, some plans may require you to opt out of mail order before you can pick up your drugs. While Part D enrollment is technically optional, if you do not sign up for Part D, you may have a late enrollment penalty if you enroll at a later time. However, you can delay Part D enrollment without incurring a penalty if you are currently covered by creditable drug coverage. Creditable drug coverage is coverage that has an overall value that is as good or better than standard drug coverage under Part D. You may receive creditable coverage from your current employer insurance, retiree insurance, military benefits, or federal health benefits. If your drug coverage is creditable, you will receive a notice from the plan around September each year. If you do not receive this notice, you should contact your benefits manager to get this information in writing. Keep these notices, as you will need proof of your creditable coverage if you decide later that you want to enroll in Medicare Part D. If you lose your creditable drug coverage, for example, if you were covered by an employer plan and decided to retire, you have 60 days after losing that creditable coverage to enroll in a Part D plan without late enrollment penalty. If you're thinking of signing up for a Part D plan in addition to your current drug coverage, you should ask your employer or retirement benefit administrator if you can keep their coverage and have Part D at the same time. You could lose your employer or retiree or other benefits if you sign up for the Part D plan. It's important to keep this in mind if your plan covers a spouse or dependents, because if you lose coverage, they will too. And it is unlikely that you'd be able to get that coverage back. You can join a Medicare prescription drug plan when you first become eligible for Medicare during your initial enrollment period, which begins 3 months immediately before you turn 65, the month you turn 65, and for up to 3 months after you turn 65. After you enroll in a Medicare prescription drug plan, you must remain with that plan for the remainder of the calendar year. You can also do enrollment into Medicare Part D during the annual enrollment period, October 15th through December 7th each year. If you had Part D coverage already, you can also change your Medicare Part D plan during open enrollment. There are also other times when one can disenroll or get a special enrollment period. It's a little too lengthy to address in this presentation, but all of it is covered in the Medicare New Book, which is provided to all Medicare beneficiaries each year. We can also look into that for you further if you contact MAP for an appointment. Enrollments can take place outside of the normal open enrollment period if you have what's called a special enrollment period. This can be used depending on what the situation is. If you have a special enrollment period because of losing job-based insurance or creditable drug coverage, you can use it for up to 2 months after losing that creditable coverage. You can also use a Part D special enrollment period if you've had creditable coverage through any of the following: Veteran Affairs benefits, TRICARE for Life, Federal Employee Health Benefits, and some retiree plans, COBRA, or job-based insurance plans. If you do not have creditable coverage and you do not enroll in Part D, then you must pay a late enrollment penalty. It is added onto your monthly premium and it will continue with you the entire time that you have Part D coverage. So let's say that you delayed your enrollment into Part D for 7 months and you did not meet any of the creditable coverage exceptions listed prior. Your monthly premium would be higher by an amount that is 7% of the national base premium for as long as you have Part D. The national base beneficiary premium in 2022 is $33.37 a month. Your monthly premium penalty would therefore be $2.34 per month, which you would pay in addition to your plan's premium. Please note that the Part D penalty is always calculated using the national base beneficiary premium, and that does change each year. Your penalty will also not decrease if you enroll in a Part D plan with a lower monthly premium, nor will it increase if you enroll in a Part D plan with a higher premium. The Part D penalty is what the penalty is calculated and then is added onto your monthly premium amount. If you have a higher income, you might pay more for your Medicare drug coverage. If your income is above a certain limit, $91,000 for those who file individually, or $182,000 for those who are married and file joint, then you'll pay an extra amount in addition to your monthly plan premium. This is referred to as the Part D IRMA. You'll also have to pay this extra amount if you're in a Medicare Advantage plan that includes drug coverage. The chart below shows your estimated prescription drug plan monthly premium based on your income as reported on your IRS tax returns. If your income is above that limit, you'll pay the income-related monthly adjustment amount in addition to your plan premium. Please note that when they review your filing status for the yearly income, it is going to be based on 2 years prior. So for 2022, they're going to look at your yearly income for 2020. If you have had a life change like retirement, there are forms that can be filled out and sent to Medicare and Social Security to have those IRMA amounts adjusted. If your income and assets are below a certain level, you may qualify for extra help, also known as the Low Income Subsidy. This is a federal assistance program that helps pay for prescription drug costs. How much that you pay for your prescription drugs and your monthly premium depends on whether you have full or partial extra help. There's also programs with Medicaid, drug manufacturer pharmaceutical assistance programs, and GoodRx. Contact MAP if you feel that you are having a hard time with the cost of the prescription drug plans. Let's see if there's any way that we can help you get into one of these programs. MAP is here to help. If you want to speak with a counselor about your specific situation, just give us a call. We're currently counseling over phone and Zoom and entering back into the community where facilities are available. Our services are confidential and unbiased, and no question is too trivial. We often deal with very complicated questions as well. And for resources outside of MAP, you have the Medicare and You Handbook, which is state-specific, showing specific plans for Michigan. You'll receive a hard copy each fall, but can access an electronic version all year online. You also have Medicare.gov, which is Medicare's plan finder and website. And of course, you can call 1-800-MEDICARE as well. However, for the best resource for your local Medicare information, that is MAP. Our services are free and unbiased, and our certified counselors are not sales agents and not affiliated with private insurance companies. We can be your best resource for all questions and concerns Medicare. There's no question that is too small or difficult, and we've saved over $2 million for our beneficiaries in your area. Give MAP a call, 1-800-803-7174. And of course, if you have any further questions, please feel free to reach out to me, Melissa Devine, at mdevine@AAA1b.org. Thank you so much for spending time with me today to learn on how to choose the best Part D plan for you. I look forward to assisting you further and having more webinars with you soon.